Vaporizers. In this module, we will be discussing the function, major features, hazards, and safety of the vaporizers. Important functions of the vaporizer include changing the liquid anesthetic agent into its vapor state and delivering the specific dosage and concentration of the agent into the gas mixture. The internal mechanisms of the tech vaporizer consist of features that provide a system of checks and balances to help maintain flow volumes, temperature, and pressure, which allow delivery of a set vapor ratio. Flow volumes are controlled and maintained by the concentration dial of the vaporizer. The concentration dial operates a valve which splits incoming fresh gas into two streams. First, the bypass path, in which stream continues to flow out of the vaporizer without being exposed to agent vapor. Second, the carrier gas enters a path to the vaporizing agent in which there is liquid agent. The splitting of the gas streams is part of a variable bypass method. In an off dial position, the inlet and outlet of the vaporizer is occluded. In the 1/2 on position, the gas flow passes the bypass path and the vaporizing chamber. And in the full on dial position, the entire inflow of fresh gas may be directed into the vaporizing chamber. Temperature greatly influences the amount of fresh gas that is diverted down to the vaporizing chamber. Temperature fluctuation is controlled by a thermostatic valve to keep the output constant regardless of temperature variations that occur in the vaporizer. There are two metal strips that are bonded together, a bimetallic strip, which serves as a thermostat in the vaporizer. The thermostat bends to the left to allow more gas through the vaporizing chamber when the temperature decreases. On the other hand, if the temperature increases, the thermostat bends the other way to restrict the amount of gas to the vaporizing chamber. The vaporizing chambers have a system of wicks which extend into the liquid agent reservoir and draw agent upward. These wicks are spiral-shaped to maximize the surface area of carrier gas exposed to liquid agent, which expedites vaporization. Saturated carrier gas converges with fresh gas in the bypass channel and exits the vaporizer through the common gas manifold as it makes its way to the breathing system. Unlike other tech vaporizers, Desflurane models electronically control the temperature and pressure inside the vaporizer. Furthermore, the wick system is not utilized because Desflurane saturates carrier gas quickly. One very unique feature of the Desflurane vaporizer is the visual and audible alarm that signals the user when the vaporizing condition is not optimal or when agent in the vaporizer is almost empty. Hazards and safety. Misfilling. Filling a vaporizer with the wrong agent can inadequately or excessively anesthetize the patient, depending on which drug is placed in the vaporizer. The Estiva vaporizer is equipped with specific key fillers to eliminate error. However, some Estiva machines do not. Therefore, it is important to carefully read the label to make sure it is the right agent going into the vaporizer. Contamination. Using a contaminated bottle of anesthetic agent can potentially harm a patient. An acidic odor can sometimes be noted and should be disposed. After use, make sure that the agent is properly stored. Tipping. This is unlikely to occur when the vaporizers are correctly attached to the vaporizer manifold unless the entire anesthesia machine is turned over. Excessive tipping can cause the liquid agent to enter the bypass chamber and can cause output with extremely high agent concentration. If vaporizer or machine is tipped, it should not be used until it has been flushed for 20 to 30 minutes at high fresh gas flow. Overfilling and underfilling. Improper filling procedures can cause patient overdose or a fall in vaporizer output. Most modern vaporizers are now equipped with side fill rather than top fill designs, which largely prevents overfilling. The Desflurane vaporizer has a low agent indicator that comes on if the volume of liquid agent is less than 60 milliliters. The sevoflurane and isoflurane vaporizers do not have a low agent indicator. Therefore, it is important to keep a close eye on the levels. Simultaneous inhaled anesthetic administration. Newer machines have a vapor interlock system that prevents simultaneous gas administration. However, some of the older machines do not have the vapor interlock system, allowing two gases to be administered at the same time. Therefore, the provider must be vigilant to make sure that only one anesthetic gas is being used. Leaks. The most common cause of vaporizer leak is a loose filler cap, which can cause leakage of anesthetic gas vapor to the environment and can potentially result in patient awareness during anesthesia. Make sure that each cap is closed appropriately. Safety features. Safety features of the vaporizer include specific agent key fillers, low filling ports, a manifold which secures the vaporizer, and an interlock system which only allows one agent to be utilized at a time. This concludes the vaporizer module. In summary, we discussed the function, features, hazards, and safety of the vaporizer.